Not too long ago, President Donald Trump of the United States declared a public health emergency in America in order to deal with the crisis of addiction. American media call it opioid crisis, as many Americans inject themselves every day that they go above board and end up killing themselves. Many blame doctors who prescribe them opioid with little questions. Also recently in Nigeria, the federal government banned the importation of cough syrup that contains codeine, considering the fact that the misuse of drug and alcohol is the leading cause of preventable illnesses and premature death. All over the world, people abuse opioids, heroines, drugs, even alcohol. Many blame doctors who prescribe this medication with little questions. In addition, many argue that pharmaceutical companies maintain a corrupt relationship with doctors who end up prescribing the medication. Given the disastrous impact of this drug misuse on the family, workplace, economy, and the society, we shall be throwing our searchlight on the issue of addiction on your program Policy on Track today. My name is Mo Ogbonewilki, your host, and you are welcome. As our tradition, here are stories making rounds in the world of work in the last 1 week. The biggest threat to jobs might not be physical robots, but intelligent software agents that can understand our questions and speak to us. British retail giant Marks & Spencer is moving 100 switchboard staff to other roles because chatbots are taking over their duties. A tool is used to transcribe customers' verbal requests and understand their intent. Then the call is routed to the appropriate department or shop. This system is said to be able to handle about 12 million queries a year. The Nigeria Labour Congress has joined other well-meaning Nigerians in condemning the demolition of the music house by the Oyo State government, the building belonging to Yinka Ayefele, the physically challenged music maestro. NLC says the conduct of the Oyo State government represents an audacious affront to the court that gave a restraining order and an assault on public morality. NLC, in his view, says the music house, other than providing multiple sources of livelihood to many, represented a strong message to the nation's teeming youth that disability is not a barrier to industry or self-actualization. The Southwest Zonal Chairman of the National Union of Road Transport Workers, NURTW, Taofik Oyerinde, popularly known as Fele, was on Wednesday committed to Mother Earth amidst tears and sober reflection. Fele, who also doubled as the chairman of the union in Oyo State, was described as a man of peace, largely responsible for the tranquility experienced in Oyo State and the Southwest region generally. Recall that activities of members of the NURTW before this administration made motor parks and motor stations a violent place when there was disagreement within parties. The late Taufik died in Abuja Hospital following a brief illness. Over $700 billion is needed each year in the United States to tackle the opioid crisis for addicted individuals to be able to access effective outpatient treatment. Despite these efforts, hundreds of thousands of people continue to pay with their lives. I sat with a psychiatrist in the United States, a certified addictionologist, and an expert in drug, Dr. Mobolaji Oyebanjo Pokuola. She traced the addictive problem to the generous giving of pain pills without monitoring by doctors. We crave the indulgence of viewers in the amateur recording.
Addiction is a condition in which A person engages in use of a substance or in a behavior for which the rewarding effects provide a compelling incentive to repeatedly pursue the behavior despite detrimental consequences. There is no one cause of addiction, although experts say genetics or biological factors may contribute to vulnerability to the condition. Many social, psychological, and environmental factors have a powerful influence on substance use.
Addiction problem is not a new problem to the US, and heroin problem is not a new problem to the US. They've had it on and off for years. Addiction changes. But the most recent heroin problem was heralded in by the prescription pain pill. About 2 decades ago, the doctors were encouraged to start monitoring the pain more actively. And at the same time, drug companies came up with pain pills that could address pain. Unbeknownst to people, the pain pills that came out about 2 years ago were highly addictive. They belong to the family called opioids, which heroin also belonged to. So for about a few years, people were giving out the pain pills generously to the patients without necessarily monitoring them. And before a couple of years, we noticed that we had more addicts to the pain pills on the street. So this episode actually was heralded in by prescription pills, like amphetamine and codeine, and all those Ultram, Tramadol, just to name a few, by well-meaning doctors and patients who were in pain.
People who abuse drugs or alcohol can experience serious consequences such as accidents, overdoses, crime, school problems, violence, and suicide.
What is the impact of this on the society?
It is disastrous. First thing first, addiction is just an obsessive use of a substance or engagement with an activity at the expense of other things. So let me give an example of a man. A man has a family, and instead of providing for his family, is diverting the money that is supposed to use to buy food and pay school fees towards it. So he's stealing from his company, right, to feed his addiction. That's one thing. So the diversion of resources is one of the major things. Then is also the criminal behavior. Addiction is so bad and it impairs the judgment so much that when people are high, they do things they would not normally do. Some people become violent. Some people make mistakes. For example, if somebody's working in the factory, and they're handling heavy equipment, if they're high, they could accidentally run into other people or even accidentally kill people, or not to talk of the person on the street who is driving trailers or other cars. They could accidentally kill other people because their judgment and their reflex time has been reduced by addiction. One more thing, at the workforce, they call out sick a lot. Because when they're coming off the drugs, which is the withdrawal is very, very painful. What we call hangover. What happens to such a person? They call out sick. The other thing is that if they come to work, they make a lot of mistakes, which could cost the company very dearly. If I were to put a dollar figure to it, last year, drugs alone cost America $0.7 trillion. That's a lot of money. And that is the one they captured. What about the ones they didn't capture?
Although all addictions have the capacity to induce a sense of hopelessness and feelings of failure, as well as shame and guilt, research documents that recovery is the rule rather than the exception, and that there are many routes to recovery.
How would an employer be able to help his employees who are hooked on drugs?
The first thing is a policy. What drugs policy do you have in place? For example, in our clinic, before you start work, we have a well-crafted policy that we will screen you, and we just don't screen for one or two drugs. We will screen you for drug use. So, random screening is a deterrent because they know that they can use, if they're caught using drugs, they could lose their job. The second one is providing employee support services. If an employee starts to use drugs, then we do have employee assistance program where they can call anonymously and seek help. Over here, every motor vehicle accident, the first thing they do is to check you for drug screens. It's not just alcohol. Are you using tramadol? Are you using codeine? Are you using cocaine? Then the policies in terms of supply, they need to enforce the policies in terms of people bringing drugs into the country.
As the biggest economy in the world, the United States battles the abuse of drugs and addiction, which have reached an epidemic level. The federal government of Nigeria, in like manner, as a step of facing the challenge of drug abuse, recently banned the use of syrup with codeine. In an interview I had with a psychiatrist in Nigeria, Dr. Memuna Kadiri, she said banning of syrup with codeine is not the best option. She said it will rather cause an upsurge in alternatives to the syrup. Dr. Kadiri said the issue of mental or behavioral health challenge is not being adequately managed in the country. She advocates for substance drug policy to be engraved in the workforce as a step to fighting the challenge, amongst other measures. Let's look at the issue of addiction. What exactly is addiction?
It's a word that is being used when someone is addicted to a particular thing. So addiction does not necessarily have to be on drugs. You can be addicted to anything, irrespective of if you begin to start using that what you're addicted to. When you start seeing yourself using it more than necessary or frequently, when you start neglecting all other activities just to focus on that particular activity you are doing. So let's take, for example, now somebody who is addicted to watching television, because that is an addiction for some people, or somebody who is addicted to social media, because there's actually now a diagnosis for internet addiction under the diagnostic criteria on the International Classification of Diseases under mental and behavioral health. When you start seeing that you have this, you need more time to focus on this particular activity as against other things you are doing. So there's what we call tolerance, there's what we call dependence before you go into an addiction. That's why I said addiction is never an event, it's a process. There's that part of the brain we call rewarding center that keeps, giving that feeling, that good feeling effect to the individual. So the effect you got initially when you started using the drug, or when you got addicted to the food or to the activity, you want that same effect. So you'll be increasing the number of hours you spend on that activity, or the amount of dosage you took on that drug, even food, even sex, even pornography.
There is a possibility of it affecting productivity.
Definitely.
So let's look at drug addiction. What is drug addiction, and how did we as a people get into this?
Drug addiction is a big issue. It is a big issue because it comes with a lot of negative vices, it comes with a lot of health challenges, and because it's an addictive issue, it's a mental and behavioral health challenge, because it affects not only the individual but most times the society in general. So for drug addiction, why we see it as a major health challenge, because the individual, before they get to that addictive stage, they might have told themselves that, oh, if I take a bottle of alcohol, it don't change anything. I can stop whenever I want to stop. So they always tell themselves, I can. That control is what leads, that lack of control is where addictive process starts coming in. Because when you ask people that take substances or drugs, they tell you, oh, it makes me calm, it makes me sleep well, it makes me happy, depending on the drug the person is taking. Anybody that's addicted to any substance must be evaluated. And like I said earlier on, it's not an event. The person must be evaluated to now know, is this person addicted, or is just a regular user, or is just dependent on this drug, or there are issues with tolerance. Because all these I'm talking about, they are all medical disorders. They are all mental disorders. They are all diagnoses. They are not just words that you just use. So they are going to be mental and behavioral disorder due to marijuana use, maybe with heroin or any of those substances. And if it's addiction, we will not know. So not everybody taking substance or drug must be addicted. So we need to let Nigerians or everybody in the world know that no. And then evaluation will now tell us specifically the level where that individual is. Because there's definitely, how did you start? If you are taking marijuana now, maybe the person started with cigarette and alcohol, which are the gateway drugs. So alcohol and cigarette are the gateway drugs to many other substances. And then there's that craving. For any time the person is not taking the marijuana or taking the alcohol, there's that feeling that, oh, I need to take it. And then you see at that stage, that's when they now damn other things, they neglect work, they affect other people, they don't go to work, they start having issues with police, they start having crisis with families, relationship issues if the person is married, and all those other problems are now setting. Then of course the tolerance, the dependence, then the addiction. So it must, that sequence must go in.
You talked about evaluation.
Yeah.
How good are we in Nigeria about going through this process? I mean, people that have this issue, because we see that most times some people go spiritual. Some people tend to say they want to treat themselves. Where are we as a people?
As a people, we are in Nigeria, we are still very poor in the area of evaluation. Not from the specialists, but from we as individuals, as Nigerians, going to seek for help. We are, quite a number of us are still in denial. A certain percentage of us just believe that there are not good evaluators in Nigeria, or the healthcare system is down, there's you won't really get any good thing from it. But the truth is that any trained psychiatrist in Nigeria can evaluate an addictive process. So even if it's not a drug addiction psychiatrist, they will know how to evaluate. And of course they will also know, okay, this person has drug addiction process, the person is also hypertensive, or the person is also diabetic. So you now see both physical and mental illnesses combined in that individual. Would the church know that? Would the monks know that? Would the herbalists know that? No. That is why it's still very paramount for anybody who is going through any process like this or any issue like this to still visit, even if you are not going to a teaching hospital, visit that healthcare center. We say, no, this case is too much for us. We believe a teaching hospital, the teaching hospital, we have doctors that will look into it. Or no, it's addiction issue, go to psychiatric hospital, Yaba, go to Aro, go to Selu, go to Meduguri, go to Kano. There are 8 psychiatric standalone hospitals in Nigeria, which the government has put in place, which is we will say is enough. No, we are like 200 million Nigerians now. The truth is that we have 1 psychiatrist to 1 million Nigerians. There's a huge deficit of human resource when it comes to that field.
Let's look at the workforce generally. How would you rate the policies on drug tests if it does exist in our offices,
it does.
in our workplaces?
It does in quite a number of the multinationals, if not all the multinationals, because it's not a Nigerian thing. It's from their head offices. So automatically they must adopt it to fit into wherever the offices in the world. Health and safety issue when it comes to the oil companies. I think quite a number of the oil companies, apart from the multinationals, also kind of adopt that, in the sense that they have that policy for anybody who they think could be going through such. So they kind of randomly send people to the unit to go screen. On a larger scale, when it comes to the workforce in Nigeria, no, we don't have such. Those policies are not so engraved. Somebody who smokes cigarette, the storm that they throw can, like especially in the factories, can cause that. So the truth is that we are not saying that the workforces don't have policy, but when it comes to this substance drug policy, I believe it should be very clear. People sign on it and know the repercussions, and that brings us to the fact that now there is a workplace mental health will I would say activity, no, a program for the workplace. And because we don't want to use the word workplace mental health, is beautifully wrapped into what we call employees assistance program or employees wellness program, whereby the employees in that work environment can easily have access to talking to counselors, to talking to therapists that will help them to deal with the work challenges and personal issues. And luckily we've been registered in Nigeria. And every institution should find out how to assess this, to be able to help them maximize productivity, and of course what they are looking at is profitability in the work environment.
Recently the federal government banned, particularly on the shelf and what have you, of syrup that has codeine, in an effort to reduce drug abuse. What is your assessment of this?
It's a no.
Because because given the fact that even after the ban, we see that the smugglers have not ceased.
We call that rush in, rush out. You don't make such hasty decision. Yes, syrup containing codeine is medicinal. It's the abuse of it that is a problem, which we have seen has been on the increase. People say it's geographical. Yes, that is more in the north than in the south. Whichever one we are going to say, the truth is that banning it was not the right decision. Putting policies in place that will be implemented, that will come out with, if you do this, this is what the charges you will face. Things should be, if they are properly well documented and legally backed up, and people are being used as scapegoats, definitely we'll start seeing changes. But when you ban it, now what did we find out? Increase, upsurge, illegality. So now we will not only see syrup containing codeine, we may even see some other more dangerous substances coming out, alternatives to even the codeine that is even in the syrup. So for us, that ban is a no, and it shouldn't have come at that point. Though we know that it has been lifted, but the truth is that it shouldn't have come. It was too hasty.
The ban on syrup that contains codeine has been described by some as a rush-in, rush-out measure. Rather, they advise government to deal with the challenge of drug or substance abuse holistically through proper regulation, among many other steps. That will be all for today. See you again next week. I am Ogbone Wilkie.